As we continue to flatten the curve here locally, many people fear the possibility of a second wave of COVID-19. CBS 2's Dr. Max Gomez tells us what we can expect as the seasons change.
There are a variety of opinions as to what the COVID-19 pandemic will do as the weather gets warmer. Will it slowly dissipate as the flu usually does? Some coronaviruses, not this one, cause common colds, and those corona colds, while less frequent, don't really go away in the summer. The fear is that even if this coronavirus behaves like the flu this summer and causes fewer cases, that it might also act like the flu and come roaring back in the fall. In fact, that's precisely the fear of the director of the CDC, Dr. Robert Redfield, who told the Washington Post yesterday, there's a possibility that the assault of the virus on our nation next winter will actually be even more difficult than the one we just went through. In other words, if a flu epidemic and COVID-19 epidemic strike at the same time, the nation's health system could be even more overwhelmed than it was this time around. There are, however, reasons to believe that even if the flu and corona do overlap in the fall, we should be better prepared then. For one thing, healthcare workers will know more about what to expect, and hospital supplies of personal protective equipment, PPEs, ventilators, and other equipment should be replenished. And while the early symptoms of the flu and COVID-19 are very similar, hospital epidemiologist Dr. Jennifer Leiter at the NYU Langone Health System says better testing in the fall will help.
Diagnosis will be much easier than it was 6 weeks ago when you were really basing diagnosis on the clinical basis, how the patient's signs and symptoms and not on an actual assay.
And Dr. Leiter told me that by the fall, we should also be much better at treating the coronavirus.
Hopefully with the clinical trials that are ongoing, we will be able to produce some evidence that the treatments we are currently using may be effective.
One more note of optimism. By the fall, it looks like many millions of Americans will have been infected and recovered from the coronavirus and should possibly have some level of immunity to reinfection from the virus, which should ease the severity of any second wave of coronavirus infections, as will getting the flu shot. Get your shot in the fall. Dr. Max Gomez, CBS 2 News.